Hello and welcome to UT Health San Antonio Leadership Podcast, the show that profiles individuals in leadership positions at UT Health San Antonio. I'm your host, Celeste Rodriguez, and today we're going to talk about personal growth, success, and doing everything it takes to make lives better. Dr. Ramachandran has been with UT Health San Antonio since September 2022. Dr. Ramachandran received his primary and high school education in India after he completed a year of pre-medical training and then entered the All India Institute of Medical Sciences, the top-ranked medical institution in India and South Asia. He then completed his clinical research fellowship from Washington Hospital Center and his research fellowship in cardiology from the Framingham Heart Study. Please join me in welcoming Dr. Ramachandran. Joining us today, Dr. Vasan Ramachandran is the founding dean of our new University of Texas School of Public Health here in San Antonio. Now, this is a partnership between UT Health San Antonio and UTSA. I'm so very excited to have you here. I know you just started a few months ago, but I do feel like you've already made quite an impression on all of our folks here at UT Health. But I want to know, and all of our listeners do, what does the inaugural dean of the School of Public Health here, what do you do?
Yeah, thank you, Celeste, and good afternoon. I think the dean of a School of Public Health, she, he, or they are the administrative leader of the School of Public Health, which means both looking outwards and looking inwards. They inspire the mission, the vision, and the core values of the School of Public Health. And they work with the faculty to develop the core curriculum and what we call as the tripartite mission of the School of Public Health. And those three parts include an educational mission, which in this case includes a master's in public health, which we hope to start in fall of 2024.
That's exciting.
And a doctoral program in public health in the subsequent years. It also includes a research mission on public health areas and topics of interest. And there always has to be a third mission, which is serving the community where the public health is located. So the dean is the administrative leader. He works with the faculty senate. That's a body that represents the faculty to determine the content in each of these three parts, and he or they are the ambassador when they represent the School of Public Health outside, and also integrating in this specific case with the other 5 schools which are part of UT Health.
Well, I'm so excited because it feels like this is just big, huge gap that I feel like we've had for such a long time. So I'm so very excited to have you here. And I know you're new, you started just a few months ago, but can you tell me, who do you have on your team so far? What does it take to run the School of Public Health?
Well, it takes a village to run a School of Public Health.
I can only imagine.
We have 4 members, including myself, at this point of time. Within the School of Public Health, we have an associate dean for finance and administration, Dr. Deepu Korean. He comes to us from University of Houston. And we have Courtney Peebles. She's our director of operations and administration.
Yeah, Courtney's great. Yes, worked with her before.
And we have Joanne Bastian, who's the administrative assistant. We do have a lot of help from large parts of UT Health. For example, we have Fidel Flores, who's part of Marcom, representing the School of Public Health. Likewise, we have Amber Sharp, who's part of the financial team, but who liaises with the School of Public Health. So there's an army of people who are part of UT Health who work and collaborate with the School of Public Health. But at this point, our core 4 members include the dean and the 3 others. And
the fantastic 4. That's what y'all are right now to start with.
Fabulous 4.
Well, and it's good that you have some strong internal folks too, because that helps also. So I'm really excited for you. And are you a native Texan? I know you're not, so you can tell me.
I wish I was. I wish I could brag about that part. But
I know we're crazy. I know we're crazy here. It's fine.
I intend to be a native Texan over a period of time, however you define nativity.
I know. You know, it's funny because once you start, I know you shared with me your regimen in the morning for your breakfast, but once you start adding in the breakfast tacos, then subbing for the healthy oatmeal, the native Texan kind of kicks in after that. So tell me, where did you grow up?
I grew up in India, in the northern part of India, in a city called New Delhi. It's the capital of the country. And I did my initial schooling over there. I went to a Catholic school called St. Xavier's. And then I went to a medical school there called the All India Institute of Medical Sciences. I can talk more about either of them if you wish.
Yes. No, I want to know. So what, the medical school that you went to, All India Institute of Medical Sciences, right? That's the name of the school. What was your primary study there?
Yeah, I did my undergraduate education in medicine over there. I did my residency in internal medicine, and then I did my fellowship in cardiology. So that's about 12 to 14-year program.
I know, I was about to
depending on
say,
what
how
you
many
do.
years of school was
It's long.
that?
And then I joined the faculty over there before I came to the United States for further training.
So what was your first job? Was it right out?
My first job was to be a faculty member at the All India Institute of Medical Sciences. I was an assistant professor over there. So I was an attending and had responsibilities as a non-invasive cardiologist. And in part of that capacity, I was also fortunate at that particular point to end up as one of the cardiologists looking after the Prime Minister of the country.
Wow, that's a big job. You show up to work, you have one job to do, and you can't mess that one up. What led you into cardiology?
Yeah, it's a great question. I think in part, my paternal grandfather, he had a history where he died young, presumably of a heart attack. And the best department, or the one with the best reputation in the All India Institute of Medical Sciences, was the cardiology department. So when you enter as a medical student, you look up at the people and you say, wow, could I ever be like any one of them?
Right.
And then you pursue the people who inspire you. So there were great role models, several of whom set up the cardiology department and had been trained in the US. So they were very inspiring, and their leadership drew me to cardiology.
And then how did that lead you into public health?
It's a great question. So in 1991, there was a World Preventive Cardiology Conference where I was asked to speak. And one of the speakers was from the UK, Professor Neil Poulter. He showed a cartoon where he shows a long conveyor belt, and he shows a tap which is open and water flowing down the conveyor belt. And on the other side of the conveyor belt is a doctor in a white coat called Dr. Mop. So when I looked at that slide, I said, yeah, that's me. So I could keep doing one cath at a time, one patient at a time, one CCU bed at a time. But somebody has to shut off the tap.
Right.
So that led me to thinking that my job could be to figure out how to shut off the tap and lower the burden of heart disease that developing countries like India face.
And I think it's also such a good fit here in San Antonio for you. And can you tell me why, what drew you into San Antonio? Because I'm very curious about that.
Yeah, it's my wife is a neurologist at San Antonio. She's the director of the Glenn Biggs Institute, Dr. Sudha Seshadri, and she's been here for 5 years. And we were telecommuting, and I was going back and forth between Boston and San Antonio over the last 4.5 years. And every time I came here, I was struck by the warmth of the city, about the richness of its history, about the cultural pluralism, and about the unmet needs as well in the area. So when a suitable opportunity presented itself, I felt like, what do I need to do with the next 20 years of my life?
Right.
And I thought, perhaps it's time to move from Boston to San Antonio.
Yes.
And work with an army of people and contribute to making a difference.
Yeah, and I just really feel here in San Antonio there's such a difference to be made. So I'm very excited to see what you do in the future because you're right, the culture here, I always tell people it doesn't matter what part of town you go to, it always feels like a small town. Somebody is always very nice and welcoming and will definitely help you, literally the shirt off your back, gas in your tank if you run out. Like the people here in San Antonio are quite probably the best in Texas.
Absolutely. I can feel the spirit of collaboration and community very strongly.
Mm-hmm.
And that's very inspiring, and that's very important for public health. And also raises a moral imperative. How do we do something so that the average man, woman, child, family is better off as a result of what the School of Public Health does?
And also collaborating with UTSA. Can you tell me about that?
Yeah, that's a very important collaboration because it's the undergrad campus.
Yeah, it's huge.
And there is very strong support from the leadership of both UT Health and President Taylor Ramey, the president of UTSA, to support a program in public health. And what it does is that it marries the strength we have in medicine and nursing and dentistry and School of Health Professions with other strengths that we need, which are within the public health domain, in environmental sciences, in health policy, in management, in health services administration. So the combination of UT Health and UTSA is a tremendous, it's a tour de force that really is a fertile ground for building the public health workforce of the future, the next generation of public health workers.
Yeah, and UTSA, UTSA is phenomenal for that because they're already Hispanic Serving Institute. It's one of the largest, I think, in the state. I don't even know, what number it is, but I know the enrollment there is very large.
Yeah, I think it's about 35,000
yeah,
or so
I think
students.
you're right. Yeah, I think you're right, in the mid-30s for sure.
It's a Hispanic Thriving Institute.
Yes. And so, I mean, it makes the most sense when I saw your announcement that you were coming and that it was kind of a collaboration. It almost seems like the whole city of San Antonio is really kind of rallying around this public school to be very successful.
I'm rallying around the city of San Antonio
I
and
know.
UTSA.
You're
and
making your way around the city very quickly. So I want to know, somebody in your position now, after you graduated high school, did you know what you wanted to do professionally? Did you know you wanted to be a doctor, since you were young?
Yeah, I did know that I would want to pursue the medical profession. My older brother was in med school, so that inspired me, and I always wanted to be a physician. And like I said, once I entered my medical school, I drifted towards cardiology because of the most inspiring department, at least for me, in the school, in the medical school. I think I made a few shifts in my career as a physician when I came to the US and trained further in epidemiology at the Framingham Heart Study. I discovered a part of me that I did not know existed, that was how to be a physician scientist. And I thrived with that feeling and with the ability to be a physician scientist, and then made a further shift towards public health with the realization that being a physician scientist, the next frontier is the public health laboratory, where you want to make an impact in the lives of ordinary men and women and families and children. And that means you need to shift your sandbox from the medical school or from a department or from an institution into the communities that really matter. And the pandemic sort of reminded us time and again about the false dichotomy between clinical medicine and public health. So it's a continuum, and so I moved from being a physician to a physician scientist to being an epidemiologist, and now representing public health.
And it all makes sense when you lay it out that way, right? It all makes sense on how you arrived to be right here where you are now. Because without all of those foundations, it wouldn't have made sense for you. So that journey was crucial.
Yeah, it's like doors open, and you walk through them and you follow your North Star and your intuition, and you find sooner or later you find yourself where you belong.
And I'm so glad that you're here, because you're right. During COVID, it was this huge just wake-up call almost for really, we thought, we're going to be able to do X, Y, and Z, and this is going to be very easy. And then you go back and you're like, basics. People don't have internet. people don't have access to, go get the vaccine. People don't have access to X, Y, and Z. So it was definitely a wake-up call all over again.
Yeah, I think you raise a good point, Celeste. I think on paper in 2019,
Mm-hmm.
there were reports saying that the United States is the most prepared country to face a pandemic.
Right.
In reality, when the pandemic unfolded, we have over 1 million deaths. And I think the gap that represents between what we are on paper and what turned out in practice
Mm-hmm.
reflects an important unmet need.
Yeah.
And I think you touched upon some of the points that not only there were issues about our response, the public health response, there was also a social patterning of disease about who
Right.
got hit
Right.
hardest. And the pandemic also ripped the band-aid off the underlying substrate which we had not attended to, called vaccine hesitancy,
Mm-hmm.
about how do we share with the public what's going on. And I think we learned and are still learning a very valuable lesson. How do you communicate uncertainty to the public and partner with them?
Right.
Because
And
we
build
told them there
trust.
would be vaccines,
Right.
we told them they would be effective. It didn't turn out that way.
Mm-hmm.
So I think one of the lessons over here is a tremendous impetus to define a new way of doing public health, which is much more carrying the public with you
Mm-hmm.
collaboratively and empowering the public, and at any point of time having the humility to level with them what state of knowledge is, what is known and what is not known.
That's so true. And because I even felt like a lot of folks didn't trust the information, didn't trust the studies that were coming out, all the data that was coming out. And I worked in infectious diseases at that time. So it just felt like, we were just getting beat up constantly. But also there were some people who just weren't receptive, just didn't want
I
to.
think,
figure it
like I
out.
said, the pandemic ripped off the
Mhm,
band-aid
mhm.
on underlying substrates of, where we haven't addressed for a long time,
Mhm.
including phenomena such as vaccine hesitancy. It also taught us a lesson about how we should do a better job
Right.
of communicating with the public. The public is always right.
Mm-hmm.
So I think we as health professionals need to learn how to bridge the gap that you're referring to and do a better job currently and into the future.
Oh yeah, I hope this is a learning lesson for us all. Now, regarding your current role, I want to ask a question about mentorship. Did you have a mentor in public health, or did you have a mentor along the way that kind of steered you in the right direction?
Yeah, I've had a mentor at every stage of my career,
Mhm.
and I would recommend it strongly for anybody listening to this podcast.
Mhm.
Even if you are a professor and a dean, you still need a mentor.
That's
So I
good
was-
to know.
I was very fortunate that in my role as a physician scientist, I was mentored by Dr. William B. Cannell. He's the founder of the Framingham Heart Study, and we call
Mhm.
him the father of cardiovascular epidemiology in our own parlance. And subsequently, I was mentored by Professor David Coleman, who's the chair of medicine at Boston University.
Mm.
So once I became a division chief, I was mentored, and I continue to be mentored by Dr. David Coleman. And the other concept is that we often need a network of mentors, not
Right.
just somebody above you. So I want to acknowledge a lot of colleagues
Mm-hmm.
who I call as my peer mentors. They are the shoulders on whom you cry or share,
Mhm.
and also friends. So mentorship includes professional mentors. It also includes the support you receive with your friends and with family. And it's a wider network, and I've been fortunate to enjoy a network of mentors who have contributed to my path.
Thank you so much for sharing that, because I think it is really important that people do know, yes, you can do it all on your own, but I mean, really, are we that successful whenever we don't rely on our network or our mentors to kind of, have a shoulder to lean on? So thank you for sharing that, because I think that's one important aspect that a lot of people just kind of don't take advantage of. Now, what is your greatest passion, both professional and personal?
Yeah, it's a great question, and the two are related in parts. I'm just past 60, Celeste, and it means I'm past the midpoint of life.
You're
And
in the
I think
golden years, right?
The passion I've had is how do we leave this planet and this earth a better place to live in for the others.
Mhm.
So always becomes about others.
Mm-hmm.
And when you wear that lens, I think I mean it in the context of health, well-being, and public health.
Mm-hmm.
What do I do so that you can make an impact? The measure of your life well lived.
Right.
That it's never about you. It's about how you make it better and pay it forward for all the people who will come. So that's what I feel passionately about, to address public health and well-being and health equity. So
Mm-hmm.
right now, right front and center, health equity, both locally here in San Antonio,
Mm-hmm.
regionally in South Texas, statewide in Texas, and the country, is one of the things I feel very passionately about. And that feeds into a personal passion as well, because when the goal is so broad,
Mm-hmm.
I think a lot of what you do is based on what you listen, read,
Mm-hmm.
learn, and discuss with all the people that you're lucky enough in this lifetime to encounter. So it means having what I refer to as a transdisciplinary lens,
Mm-hmm.
to be able to see things from not only a public health standpoint or a medical standpoint, but
Right.
also other standpoints, an anthropological standpoint, a sociological standpoint, a behavioral economic standpoint. So what that does is that it leads you to reading broadly,
Mm-hmm.
and thinking about different kinds of mental models you have as you think about how to solve this big problem that we have of health inequities, with determination and with clarity
Mm-hmm.
and with success.
And the bigger picture. Yeah.
Yeah.
Thank you. No,
So
that
it's
was
very,
awesome.
very profound question.
It
Thank you.
is. No, it was a very, very profound answer. So I thank you so much for sharing. How would you describe your leadership style?
Yeah, thank you, Celeste, for that question. Leadership for me is a toolbox of skill sets.
Mm-hmm.
And you open that toolbox and you deploy different skill sets in a very situation specific.
Right.
And so leadership tends to be contextual. But in summary fashion, if you want to characterize, I'm very much a leader who likes to be known as a servant boss.
Mm-hmm.
My goal is to enable the students, the staff, and the faculty who work with me to succeed in what they do.
Mm-hmm.
So if they succeed, then I succeed as a leader. So a lot of it is about empowering, facilitation,
Mm-hmm.
autonomy, encouragement, support. I'm also, in a lot of ways, when you talk about a diverse set of stakeholders, I'm also a consensus builder.
Mm-hmm.
So those are the two terms that come to mind, that I like to think in terms of teams.
Right.
I like to think in terms of common good. I like to think in terms of a shared vision, a common agenda, and how do you ensure that and build consensus where you allow for a diversity of ideas, and yet you hone in on enough commonality that it looks like a team that's rowing. So consensus
Yeah.
building and serving the people is what I would call as a leadership style.
And what's the most important leadership lesson you've learned, and how has it proven to be invaluable?
Yeah, there are many lessons, but if you have to pick one, I think one of the things I learned is that one has to stick one's neck out
Mm-hmm.
and stand up for what you believe in. And sometimes that can come with challenges, and it
Right.
can come with penalties, but it's important to march to your true north and stick out your neck. Leadership is leading from the front and
Mhm.
being bold and making the moves that you believe are consistent with achieving the goals that you aspire for.
Thank you. What project in your career are you most proud of? I mean, because when I look you up, you have, over 1,000 publications, I think. You're ranked like one of the highest in some of the Google searches, and with all the things that you've done and accomplished, what is the project you're most proud of?
Yeah, I think it's a great question. I struggle with the word proud of, and I should say what projects am I privileged to be part of and
Mhm.
honored to have had the opportunity to to lead,
Yes,
and in
yes,
that
yes.
sense proud of. And I would pick a large cohort study called the Rural Cohort Study
Mhm.
that I'm fortunate to be one of the main leaders of, and this is a National Heart, Lung, Blood Institute supported
Right.
longitudinal cohort study that focuses on priority populations with health disparities in the southern Appalachian region and in the Mississippi Delta.
And this is lung disorders as well, right? Is that the
Yes,
one?
it covers
Okay.
heart, lung, and sleep disorders, and these are some of the areas in the country that have the highest burden of heart disease, stroke, and lung disease, mortality and morbidity. And to be able to address that with a large team consisting of 16 institutions and to be able to work together, it's probably one of the biggest privileges.
And that's huge because I think that one had about 4,600 people, right?
We are targeting 4,600 people. We are in the process of recruitment, and it's a labor of love. It's also a tremendous growth phase where you begin to understand what does it mean to work in the rural Southeast.
I can only imagine some of the opportunities and challenges that come through that because working with that group, I'm sure there's challenges just location-wise getting a hold of them. But yeah, no, that one is huge. So congratulations, because once that's how many years is that one? I know it started in 2019.
We are in 4 years plus, so we are
Mhm.
in the 4.5 years, and it's a 6-year initial wave. These cohort studies tend to be longitudinal, so we are
Mhm.
hopeful that we'll have a second wave of examination after recruiting and examining the 4,600 participants.
Perfect timing as well, right? I mean, it seems like COVID, there should be plenty of folks that you can find for that one. So best of luck. Now, tell me about a challenging time, either professionally or personally, and how did you overcome this challenge?
Yeah, I think at my age there are a lot of personal and professional challenges when I encounter this, but I have to pick one. I would go back to 1996. I was recruited to be part of a school of public health in India, the first school of public health in the southern part of the country, in a state called Kerala, in a city called Trivandrum. And I was joining a team of colleagues over there, and there was a director, Professor T.N. Krishnan, who was the director. And I was very excited to join and partner, and it so happened that before the school could formally begin, Professor T.N. Krishnan passed away. And I was pitchforked into a leadership position and told that now I would have to lead the School of Public Health.
As you had just started.
And that's not something I had bargained for many reasons.
I did not sign up for this.
I didn't sign up for this. I didn't have the appropriate qualifications, and I was pretty young and not as qualified at that particular point of time. And it also was a different city from where my wife and daughter were located.
Okay.
So they were
a family challenge as well.
in Delhi, so I was away from family, starting something which I hadn't done. And I think the main lesson I learned is that you've got to be able to accept ambiguity and to work hard and to trust and build a team and work together, because you need help, you ask for help, and you find a village shows up to help you. So it was a wonderful experience which was successful. It's a very successful school of public health, 25 years in the making.
Wow.
I was there for the first 2 years to lay the foundations, start the program. And so it was a real growth experience because I was pushed to the...
I don't think you had a choice.
I didn't have a choice. It pushed me to the zone of discomfort.
It's either sink or swim, and you definitely were a swimmer.
I was lucky.
Yeah, they were lucky. I'm sure they were lucky to have you fill those shoes. Now this question is, I normally ask, what advice would you give a UT Health employee who's interested in pursuing career advancement here? But I mean, I think in any role, whether you've just joined us or not, what is your advice to folks that are always looking to kind of make that next leap?
Yeah, I think two thoughts come to mind. One is that sign up for something that makes you jump out of bed. and get somebody to pay you for it and call it a job. Because it works well when it causes you to jump out of bed.
Yeah.
The other thing is to be an owner rather than a renter in your position, which
Mhm.
means that we are all leaders without titles.
Right.
So if you own what you do with intentionality, with dedication, with effort, and tell yourself that you are leading this, that's the ownership model. And the renting model is where you do something that you're asked to do within the confines of what you're told to do. If you move beyond that and you own it and give
Mhm.
it the best, and if it aligns with what gets you out of bed, you will see the magic that develops.
Ah, that's awesome. Yeah, I got to figure that one out.
You will.
I will. Yes, it'll come.
It takes time.
Definitely. No, I mean, and when, I guess when you find yourself working on a project that you're really excited about and you want to see the start, you want to see it through, you want to see it finished, you're right. Then it doesn't feel like, a job, so to speak. What is your best time management tip?
Yeah, that's a great one. I think learning to say no to all the things that are not your top priority. I think I often allude to the concept of rocks and pebbles. If you have a jar and you put in the pebbles, the small things, then there isn't space for the rock. The rock is your priority.
Right.
And you can't have a lot of them at any one point. Over a period of time, you can have several rocks. So you need to say no to the pebbles and make sure you pay attention to the rocks.
Mm-hmm.
And then you'll find that the pebbles fall in place. And over a period of time, what's a rock and what is a pebble changes.
Mm-hmm.
But any point of time, focusing on what's a priority and saying no to other things that come your way, being able to make that choice.
Yeah, no, I mean, I love that
Helps you
analogy.
manage
I've
time.
never heard of that analogy before, so thank you for sharing, because the rocks and the pebbles, I think keeping your priority focused on the big ticket items, the bread and butter, if you will.
Yeah, and I
because
think
you're
part of
right.
time management, the other thing besides the rocks and pebbles is leave some time for self-care, for watering the flower beds, for smelling the air
Mm-hmm.
and the flowers. So that is part of time management.
It is.
If you can pick a rock, but also leave some time for the biggest rock, which is your state of health and well-being.
Mm-hmm. I got this from an insurance salesman, actually, and he asked me once, what is your biggest asset that you have? And I was like, well, I mean, the house, the car. He's like, no, your biggest asset is you, right? And if you aren't well, nothing else can happen.
Spot on. I couldn't agree more.
I know. So, I mean, it does. It totally makes sense, because you can't give if you don't have anything left to give. So I want to know, Dr. Ramachandran, what advice would you give the younger Dr. Ramachandran?
Yeah, it's a good one. I would probably tell a younger version of myself, accept the world for what it is, rather than what you hope it will be, and learn to check your premises about your beliefs, about what part of our beliefs that we think of might not actually be true. So self-questioning oneself. When you're young, you have strong opinions, you have strong beliefs, and some of them may or may not be the way the world operates. So learning to question yourself all the time and saying, maybe a part of what I believe is not the way things actually are.
Right.
And that leads you to discover more what is the truth in a universe which is pretty diverse and complex.
Definitely. And accepting kind of the other things as well that you may not be able to change. And if you were not our inaugural dean of the School of Public Health, what would you be doing? What is your dream job?
Probably be a community organizer at this stage.
Nice. For what kind of event? Like,
largely working in the communities, working for the people and organizing them in ways and means that we can address the unmet needs that people have, and how best to help the priority populations who, in this specific case, if you look at San Antonio, whether you look at the east side, the south side, the west side,
right.
I think there's a lot of impetus to work together and to organize the communities in a way that results in upliftment of the communities and achieves greater equity, both in health and wealth and well-being.
That would be awesome. We can have you run for council.
Maybe someday.
Okay, now we're moving on to our rapid fire set. And these are just quick questions. I want to ask, what is your favorite color?
Ocean blue.
Ocean blue, very specific. That's a gorgeous color. Favorite food?
Oatmeal.
Oatmeal. Favorite movie?
English movie is Casablanca.
Oh, Casablanca, a classic.
There's an
Okay.
Indian movie called Pyasa, which is a classic.
Really? Okay, I'll have to look that one up because I'm not familiar with that one. Dream vacation?
Maui in Hawaii.
I agree with you. That is beautiful. I'm sure you've been, but it's gorgeous. Dream car?
An air taxi.
A taxi?
An air taxi.
Oh, an air taxi.
Yeah, it flies. They haven't invented one, but they are talking of that. And I
Okay.
can't wait to fly one.
I know. I think when the Jetsons came out, I think we're already supposed to be flying cars by now. I think we're behind on that. We need to speak to...
We're getting there.
We're getting there. Definitely need to speak to Elon Musk or somebody over at Tesla. I'm sure they're working on it. And if you could be any kitchen appliance, what would you be?
I'd like to be a microwave.
A microwave.
Warm.
Uh-huh.
Anything you put there, it gives you back something that makes you smile.
Uh-huh.
Serves the old, serves the middle-aged, serves the children.
Nice and compact. I
It
mean, it's
provides a
right.
warm
It's
coffee.
always there. Yeah.
Warm
It's-
coffee, warm food. It radiates warmth.
And very quickly, it radiates
Yeah,
warmth.
it's a sunny appliance.
Uh-huh.
That's what I want to be.
No, I think that's a perfect fit for you. Thank you. Well, thank you so much for joining us today on our podcast. It was such a pleasure having you share with us all of your keys to leadership and how you got here in San Antonio. I just have to say again how very fortunate and blessed we are to have you here. So thank you.
The feeling is mutual. I'm lucky to be here, and thank you for having me, and thank you for listening.
Awesome. Have a good one.
You too.
Thank you for taking time to listen to today's podcast, brought to you by the Staff Advisory Council in partnership with Marketing and Communications. Find us on My UT Health and submit ideas for future episodes. I'm Celeste Rodriguez, and remember, the only one that can reach their full potential and create a better tomorrow is you. Thank you so much for listening.